Baby Darcy is all smiles, snuggled in Mom's lap in their Westboro, Massachusetts home. Home is where Mom experienced a healing hand.
To be able to get hospital level care, but in the comfort of my home, was just absolutely amazing. And it was a really good way to transition from hospital-based care to sort of being at home by yourself.
Deja Judelson, a mom of 3, Darcy, her 3rd C-section, used UMass Memorial's Hospital at Home, the first in the nation to accept patients recovering from a C-section. The program gives patients the choice to recover at home, not discharged, hospital-level care. The nurses come to your bedside.
I had some issues with blood pressure before delivery, so it was really nice to have a nurse come in twice a day to check my blood pressure. And then I got to have the televisits with the hospitalist. So to have someone monitor me was just amazing.
The postpartum care option launched in January of 2024. It's the newest branch of UMass Memorial's Hospital at Home program. Maternity Center Director Dr. Benjamin Hammer.
What we were noticing during the active phase of the pandemic was that patients were flying out of the hospital. I mean, they were coming in, having their babies, and really looking to go home. Some of it was the restrictions on who could come into the hospital and things along those lines, and feelings about being in the hospital. But we were noticing that patients were they were wanting to go home. And we didn't notice any change in any of the outcome.
In addition to daily nursing visits, postpartum patients go home with this device. They can monitor their heart rate, oxygen, blood pressure, and medications. Is that similar to the amount of time they would get in the hospital?
It's almost identical. And what we've noticed and what we hear from patients is that being in their home, being able to be in their usual space, being able to be around family and friends, being able to receive those family and friends in their home rather than in the hospital is a win-win for them.
Dr. Judelson, who also happens to be a vascular surgeon at UMass.
Are you letting him have some?
Says the extra time with her 3 kiddos was precious.
And it was nice to know that there were people monitoring me every step along the way and making sure that I'm safe. And I just think the transition between hospital 24/7 care and home by yourself to have this kind of window is just amazing. And I wish everyone had that opportunity, to be honest. Hey Darcy, look, hi. As a mom, it was great to be able to have my kids at home and take care of this little one, well now big one, and sleep in my own bed.
The C-section recovery program is just one aspect of care provided by Hospital at Home.
Right, and the hospital does not hire additional staff. The hospital staff actually rotates between bedside care at the hospital and then doing the in-home care that we've just talked about. And of course, if there's any issue or problem, the patient can go right back to the hospital if they want to, but it seems to be working out for those who are trying it. And that is Chronicle for tonight. Thanks so much for joining us, everyone. I'm Anthony Everett.
And I'm Shayna Seymour. Have a great evening. We'll see you back here tomorrow night for another edition of Chronicle. Good night, everyone.